Okay, so this is about the cultural factors and health disparities in the LGBTQ population. So, how does the media portray this population? The first media portrayal was in the late 20th centuries, but again, it wasn't a very accurate portrayal. There's been jokes were made about being gay, and everyone was just kind of lumped into one big population. Um, there has been many shows and movies that show the LGBTQ population since that time, but there's still need for the accurate portrayal. Being gay is just men, women. There's a lot of more representation that needs to help for the transgender and queer communities as well. In just the recent years, there has been a little bit more of a distinctions of the different groups, which is great. Also, it's not a joke anymore. Being gay was still a joke on many shows and movies up until the early 2000s, and it was portrayed as a bad thing if you were homosexual. So in the recent years, a more accurate portrayal definitely has started to come out. Family and peer support is so important, especially with our youth. Coming out is happening increasingly earlier in life when youth are still living at home. And so when they have the support of their family and their peers, they have a lot better chance of taking care of themselves in both physical and mental health, which helps their health. So it's also very important for healthcare workers that we are identifying their support system. We want to make sure that these people have a support system outside of the hospital or where we are taking care of them. We want to make sure that they understand their unique health concerns. This population is a lot more risk for depression, suicide, and use of illicit substances. So if we are able to make sure they have that support system, then they're a lot more likely to stay away from those health concerns and also take care of themselves. And there's no real research that shows that there's issues that can be passed throughout the generations. It's just we need to support the people here and now. With the legal system and the LGBTQ population, there's a lot that needs to happen. Research shows that 1 in 5 young people in the US juvenile justice facilities identify in this population. Research also shows that they face higher discrimination in court and court proceedings. The legal system's already broken for the average person, but when you add in all these stereotypes and stigmas associated with this population, it only gets really, really worse. This population has a really hard time in pretrials as well as getting a fair sentence. And they face more accounts of harassment and inhumane treatments by guards and other prisoners when they are contained. They also have a lower accounts of getting help and the support they may need for successful re-entry into society. There's not a lot of support systems or resources out there for this population in the legal system. There are a lot of dangerous places that these people can go, and it's scary. A lot of it is the stereotypes, and it goes down to the issue of marriage between a man and a wife. It's not a new barrier that we're facing, it's just keeps evolving. So the general belief is a reason for a lot of hardship in this population. There are a lot of religions and other such gatherings. Some people take it as far as persecuting this population based on their biblical beliefs. There are multiple places that can be dangerous for this population. For example, Nigeria passed a bill that would only let people Nigeria passed a bill that would put people in jail if they showed support for the rights of the LGBTQ community. And Uganda recently reintroduced the anti-homosexual bill. So this proposes a 3-year sentence in jail for anyone failing to report homosexuals, and there's a life sentence for anyone participating in homosexual activity. Russia has proposed an anti-gay bill, which bans public events by the LGBTQ people and organizations. The whole idea that the government has behind this bill is that they're protecting and saving minors, which doesn't make any sense. In Honduras and Mexico, homosexuals were threatened at gunpoint and have been tortured in the past, and it's still happening today. And then in Saudi Arabia, they have sentenced people to punishments, including corporal punishment and even the death penalty for showing homosexual tendencies. So this population definitely has to be wary of where they're going. Even in the United States, there are still people and towns that might have those stigmas or discrimination towards these people. And so they do always kind of have to have an eye on their back and make sure that they're being safe. some health issues that we see with this community are a lot. Um, so these can be all of the health issues in the way of socioeconomic status, race, discrimination, health coverage, gender, geography, and biases. So we'll go over a few of those. Um, they can be part of many different socioeconomic classes, but there is research that shows that the LGBTQ population is very prominent in our homeless population. This plays a huge factor because they're not getting the healthcare that they may need. Race plays a factor, as it already does in most people who are not part of this population. And then when you add in race and being part of the LGBTQ population, there is a lot of discrimination. It's a real concern. Research shows that people who are colored face more health issues and less health coverage than their white counterparts. Health coverage can be hard to find for this population based on their unique health concerns. Some of the unique health concerns for this population are HIV and AIDS, substance abuse, mental health, and also depression. So there's also the issue of hormone replacement therapy for those who are seeking gender transition. That's a lot of insurance companies don't cover that. Some are starting to cover that, but it's this whole issue of what health coverage these people can get, and does it work for their unique health concerns. Geography can be an issue, especially with this population in rural areas. Um, in rural areas, there seems to be less representation, as well as maybe less understanding caregivers. There might only be one mental health counselor or one psychologist or even one doctor in these rural communities. And if this person has a discrimination or has a bias towards this person, they're probably not going to be getting the healthcare that they deserve, nor do they need. And so the telehealth and those other resources are really helping this population um, in that way, because it's showing them and allowing them to get the help that they need. And here are some references. Thank you for watching.